I'm Dr. Maria Sulindro. The topic today is the last session for hormone, and hormone is the fifth pillar for my healthy aging in my book. Okay, it's called No Code Medicine. Dr. Nayan Patel, who is here with me, is a pharmacist and the president, CEO of Central Drugs Compounding Pharmacy in La Habra, California. He has been a pharmacist for more than 3 decades. Dr. Patel is a bioidentical hormone expert. So, Dr. Patel, today the topic is, as we know, we are going to talk about bioidentical hormone therapy for men. So, for men and women, usually young or old, we are undergoing hormone fluctuation or depletion as we age. To ignore hormone imbalance is almost like ignoring high blood pressure or extremity swelling, urination problem, diabetes, or unexplained extreme fatigue, abdominal obesity, right? So can you please tell me, using a simple term, what makes it a bioidentical hormone?
In simplest form, bioidentical comes from the chemical structure of the product itself and not just where it comes from. The origin can be from soy or yams or in the laboratory, but the end result of the product has the exact same chemical structure as what our body produces. That's make it bioidentical to humans, and based on that, our body has systems built in how to deal with those chemicals when we take them from external sources.
So I usually prescribe bioidentical hormone therapy for men for 3 most common conditions. One is the benign prostate hypertrophy, or BPH. And then the second one is low progesterone or low testosterone symptoms. And the third one is the erectile dysfunction, or people call it ED. So first, let me talk about the benign prostate hypertrophy. It's usually from low DHT, dihydrotestosterone, or high estrogen problem. Common symptoms for this is dysuria or difficulty urinating. So Dr. Patel, can you give us an input on DHT or dihydrotestosterone therapy using bioidentical hormone?
Sure. So we normally don't prescribe DHT to anybody because your body readily converts testosterone to DHT. So there's no point giving DHT per se. Plus, DHT is about 10 times more potent than testosterone itself. So giving DHT can be dangerous if you do not do it correctly. So the best way to do it is, if you give topical testosterone, your body will convert the testosterone into DHT. The main thing is making sure the testosterone is applied to the perineum area, inner thighs. That's where the biggest conversion of testosterone to DHT happens. So in one sentence, you take DHT, you take testosterone, and your body will convert to DHT. That's the safest way of doing it.
I see. So the second problem is lowering estradiol in men. Should be an adjustment from lifestyle, I think. They should stop drinking caffeine, coffee, or alcohol, eat more protein, lower their calorie to lose some abdominal fat, exercise routine to increase muscle mass, or avoid wearing tight underwear, right?
Yes.
So let's talk about the second one, progesterone and testosterone deficiency in men.
Okay.
The symptoms usually is male pattern baldness, is almost like DHT excess, right? Or
Yes.
estrogen excess, enlarged breast, tense muscle, enlarged prostate. So it's a less urine flow, frequent night urination, anxiety, loss of self-confidence, depression, fear, easily stressed, worries, irritable, outrage, high blood pressure. Some of them have hot flashes, just like women when we have menopause. Sweating fatigue, decreased muscle mass, absence of libido, or some have problem with ejaculation, the volume, and erectile dysfunction. So, Dr. Patel, many comes in my office in their, their middle age, from 35 years and up. I told them that they are in their pre-andropause. That's the terminology for male. Just like women who have menopause, could you share with us some treatment option?
First of all, 35 is not midlife. I think they're still pretty young to me. Midlife is probably going to be like 40, 45 is midlife. But you're absolutely right. We get patients that are very young. They have all these issues about central fat, abdominal fat, eating motivations, losing hairline, gynecomastia, water retentions, and all those things. And the treatment is completely different. And again, it has to be evaluated based on individual basis. But normally, when they're young, we don't give them testosterone because they still have the potential of having babies. So we don't give them testosterone. Instead, what we do is we give them what we call as an LH or an FSH type pituitary hormones or a stimulant to help your testes produce your own testosterone. So normally what we do is we give them either Clomid, which is increase your FSH in your body, or give them HCG, which increases LH in your body, and that will stimulate your testes to produce more testosterone. So again, it's different. It's for every individual. So we want to make sure that we treat them correctly.
Ah, okay. Thank you. How many form of bioidentical hormone available? Please let us know.
Sure. So, I mean, you can get testosterone in multiple different ways. You can get into creams, you can get into pellets, you can get into injections, you can get oral capsules. There's multiple ways of taking testosterone. Every different way is a little bit different. For example, most of the injections that you take are not bioidentical. Pellets are it's a surgical procedure that you insert under your skin, and once you put it in there, it's there for 3 to 6 months, and there's no way if you overdose or underdose, you can't take it out. And the topical one is one that comes in different ways in terms of gel versus creams, and just knowing everybody's skin structure and the behaviors, we decide how we're going to prescribe them correctly. So
It's very
understanding,
personalized.
yeah, it is personalized because you're going to see one thing. There is no perfect system for men. And I'm just going to leave it at that point because no matter what you do, you're going to face with some sort of side effects. So male treatment is all about managing expectations and managing side effects of the drug therapy.
Is there any like best for the men? Best form?
The best form that I usually give them, which is the safest one, is a topical cream or topical gel in a very low dose form, applied to the perineum area, because I mean, no matter what we do, as science has advanced so much, we still don't know if we apply topically, how does it get to the rest of the body? We don't know that part. So the goal is to get it as close to testes as possible. So that way, we're assuming that the transfer system is built up to take the hormones to rest of the body. So topical form applied to the perineum area probably will give you the best results.
Oh, okay, thank you. So other important age-related low testosterone conditions are hyperlipidemia, obesity, depressions, heart disease, prostate or breast cancer in men, it's possible, diabetes, memory impairment, erectile dysfunction, and osteoporosis. So Dr. Patel, looking at all those possibilities, what's the best age to start testosterone therapy in men?
Wow, that's a loaded question, because in female it's easy because there's a hormone imbalances. When the period goes up and down, it's easy to replace the hormones. For men, they don't talk too much, and it's usually by the time the men gets to us for treatment, it's about 5 or 10 years late, because the symptom starts early on in the early 30s. They have a creepy forgetfulness. They have no motivation. The exercise levels is going down. They drink too much alcohol. It's just all these behaviors are slowing people down. And so really, you can start the replacement for testosterone in multiple forms and very early on, in the early 30s to mid 30s. We don't need to give them testosterone itself, but we can do other forms of treatments to boost their levels up to normal. But the real replacement happens after the age of 45 to 50, because at that time your body's not producing enough testosterone, so they don't need for the rest of their lives.
So is it because that they are still potentially would like to have children and we are trying to protect their testicles?
Well, that's the main purpose for when they're young and they're still in the childbearing age. We don't want to suppress the testosterone levels down and the sperm production down. So giving any form of testosterone therapy will cut off the sperm production immediately. And so there's other ways to deal with the situation than giving the testosterone itself.
Yeah, okay. So is there any side effects from the bioidentical testosterone to be expected?
Yes. Well, as I said earlier, testosterone, there is no perfect system for men. If there's too much of testosterone, either it can go towards making to estrogens or making towards DHT, and depends on which form you take. So if it goes towards estrogen, you have the higher chance of getting gynecomastia, water retention, headaches, prostate enlargement. So it becomes very, very uncomfortable. If it goes to high DHT, you have you will see what happens to me. You get bald. And it's a very common side effect by taking testosterone and conversion into the different dosage forms. So there's no perfect system for men. And again, we look at patients individually to identify what's the right system for them, and that's how we will decide what we can do with them.
Okay. How about contraindication?
I would say if they have any sorts of cancer, then I would say that let's work with oncologists. I'm not saying not to give them any hormones. I would say let's talk to oncologists and see if it's appropriate. Other than that, there's not much we see. We see very little allergic reactions, and of course there will be contraindications immediately. But other than that, we don't see any large indications. The commercial testosterone products you apply it over large volume. So that one has a black box warning because that can transfer to other family members if you come in close contact with them. Versus the compounded version of testosterone is small volume, and you can hide it so that part of the skin will never come in contact with the other family members. So really, there is no contraindication when you use compounded, or there are very few contraindications when you use compounded testosterone.
If they have a symptoms like prostate infection, or the symptoms of the BPH is very severe, the prostate hypertrophy, do you think we can temporarily stop the hormone therapy?
I think we should stop the therapy, but at the same time, we want to find out what the cause of BPH is. We want to know, is it the testosterone or is it one of the metabolites of testosterone? Is it testosterone converting to estrogen that's causing the problem?
So it's from the test then, we get it.
Test, yeah. Testosterone, no matter which way we slice it, testosterone has to be closely monitored by physicians. And, otherwise it just doesn't make sense.
Yes, okay. So change of lifestyle can enhance testosterone effects, such as paleo diet, fruits, veggie, meat, poultry, egg, fish, organic foods, amino acid supplements. Or we have to make sure that people know to avoid sugar, alcohol, caffeinated coffee, soft drinks, vinegar, cookies, bread, pastas, all this. And then avoid abdominal obesity, tight underwear or trousers. Um, for the younger patients, you should know there is such a terminology. I learned it from Dr. Patel. It's called ABC trousers. It's anti-ball crunching, right?
Yeah, anti-ball crushing.
So, so you can seek for that type of trousers because he thinks that it's very helpful. You can, your testicle can breathe easier. So, and prolonged stress is also to avoid that. Strenuous physical activities, smoke cigarettes, and drugs such as beta blocker for high blood pressure that will affect the testosterone. So, Dr. Patel, when treating low testosterone, in my practice, I also balance like thyroid hormone and DHEA. Can you please comment on this?
So, you know what you just said earlier, when you're dealing with testosterone therapy, that's the end result. The beginning, you got to make sure that the diet is good, the insulin levels are perfect, making sure the cortisol or the adrenal glands are functioning just perfectly fine. Because of that, they can also affect your thyroid levels. So making sure your thyroids are functioning okay. All this thing, it works in a symphony. Our body is not mechanical, that we cannot compartmentalize our body. So in order to get the best results, you want to make sure the endocrine system is more functioning just fine before you give testosterone therapy. Testosterone therapy, to me, is an icing on the top of the cake, but you got to get the cake ready first. So
Yes.
normally what I would do is I was always take the cortisol, the thyroids, your insulin, making sure they are functioning fine before you introduce the icing on top of the cake, which is testosterone therapy. So, you
That's a
know
good
what?
example. That's a
Yeah,
good-
without the other components, you're shooting into dark, and you will get results, but you will never be able to optimize the best results for your patients.
Yes. Okay. Thank you.
Mhm.
Now, have you heard of these adulterated sexual health supplements? This is natural quote unquote sexual health products on TV. I noticed since 2011 they advertise these that actually making supplements that is using chemical analogs to Viagra. Can you please comment on this one?
Absolutely. This is a big issue right now currently, and the FDA is trying to deal with it because there are literally hundreds of products that are out there that the FDA has sent a warning letters to them to recall all the products because they don't disclose all the chemicals that's inside the product, and majority of them have prescription drugs that are inside already. And so taking prescription medication without closely monitoring your body, it's, to me, it's a suicide mission because you have no idea what this could lead to, and eventually can cause serious problems. Most of the medication for sexual health affects your heart, and if majority of my adult male patients have issues with hypertension or diabetes or obesity, and adding a chemical that can affect the heart, it's nothing short of a suicide mission to me. So I strongly discourage all my patients to not to get anything that's over-the-counter supplements. Even if you know that your friend is making one, I'll still suggest no, because the chemicals that are coming in, we have no idea what they're laced with. There's no regulations over there, so I'll be reluctant. Uh, I mean, testosterone therapy is not that expensive. Why would you play with a non-regular product and get affected by it when there's so many good options available for a very reasonable price. To me, it doesn't make sense to do anything else besides that.
Yes, I don't know if it is appropriate. I would try, but if you can say no, not to answer this one. So for someone who is like 40, 50 years young, and they're going into like low testosterone situations, and they want to have the bioidentical hormone testosterone, what's the average cost a month, maybe?
You know, the
Oh,
average cost, yeah, most of the time, if you do the things correctly, the average cost would not run more than like 35 to 50 bucks a month. It is, yeah, this is if they don't have insurance. If they do have insurance, it may get even cheaper than that. So it is not that expensive to start off with.
Yeah. Are you saying that bioidentical hormone therapy now is covered by some insurance?
It has always been the case. A lot of the insurance do cover the hormones, not all of them. So it does goes to the insurance company, but even if it does not go to the insurance company, the cost is not very high.
Correct. Yes. Yes. Okay. So let me check a little bit here if there is any questions from the okay. Yeah. Maybe we can answer it here. Um, what negative side effects are there, if any, with taking bioidenticals? I think you had mentioned it. You want to just briefly say, tell them again?
So the bioidentical testosterone has similar side effects to any testosterone therapy, that if you give too much, it can convert to estrogens, causing water retention, gynecomastia. If it converts towards DHT route, it can cause hair loss. It can cause prostate enlargement. So closely monitoring your levels is imperatively a good, sound judgment. That's why testosterone in US is a controlled substance. And that means that you need to be closely monitored by a physician for appropriate of use.
Yes, yes. Thank you. Now, this is a similar question that we probably answered, but maybe what contraindication with men who have liver fibrosis and chronic kidney stones?
Oh, wow. Okay, so liver fibrosis is to me, I'm not sure about kidney stones, how that's going to affect it, but the liver fibrosis is an issue because all the hormones, the steroid hormones, goes to your liver to get metabolized. And so if you have liver fibrosis, you're going to have a hard time metabolizing these hormones and getting rid of it. So in your case, more than likely, you're going to need a very low dose of hormones. And the true benefits will come few weeks or months down the road, because we can't give you too much hormones, otherwise your body cannot take it. So you got to go on low dose hormones only.
Dr. Patel, if in my practice, if they have liver problem, I still give the topical because it doesn't get metabolized through their liver, get absorbed through the skin. What do you think?
Well, that's the best form of treatment, but regardless of which form you give them, they eventually have to go to the liver to get metabolized. Eventually.
Okay, and metabolize. Yeah. Yes, yes. Okay, thank you. Now this one is, do men have a baseline age to measure hormones like women do? If so, what is that age? Okay.
There's no baseline age to measure hormones. Initially, what we do is we go by the symptoms. And anybody can take a simple test. I'm sure you have a pamphlet that can give a test to them. I say, hey, do a self-test. And if the score is reasonable, then don't bother me, because you're more than likely you're fine. Just change your eating habits, exercise, you'll be fine. But if your score is very high in terms of your symptoms, then yes, regardless of what the hormone levels are, we need to do some intervention to help you get yourself optimized. So there's no baseline age, so to speak, but I would say be in tune with your body. Ask the question, is this the best of me? Can I be better than this? And if the answer is yes, can I do that with diet and exercise? If the answer is no, then what help can I get next? So that's where, so it's a progress.
I agree with you, because some young men would come to my office and they're only like like 20, also has a problem. So many of them that are that up, I mean obviously not common. They sometimes it's because they're taking the wrong like a fish oil that contains a lot of mercury maybe, so when I checked and went through everything, because it's very unusual for 30 years old with the testosterone as low as 200, and then they cannot function, right? So
Absolutely. And
I always have to test. Yeah. So
sorry, go ahead.
yeah, I think we are almost coming to the end here. Is there anything else you need to add, Dr. Patel, in closing?
Yes, of course. There's one more thing that's very, very important to me. You just mentioned just 2 minutes ago that you have young people coming to your office. It's a big issue right now. When you have a 20-year-old coming to your office with a low testosterone level, but they look all muscular and like super fit, more than likely they have been using hormones without a prescription from their friends and family or somebody at the gym or someplace, and it is not healthy at all. We do get these patients once in a while. What they have done is they have literally taken too much of hormones to make them look good, and in that process, they have literally fried their testes, and they cannot produce any more sperm. And so these young people are devastated. We do have a treatment for them. That treatment doesn't work for more than once or twice at the most. And so we let the people know that if we give a treatment to you, we want to make sure that you're not going to go back and abuse those hormones again. And if that's the case, we will help them to revive the testes back to normal and regenerate that. But it's one of those things you can't do it all the time. Once or twice a lifetime is all you can do. So that is a very common problem that I see amongst young people. And any of your listeners that know these people, they should send to you and help them get off that bandwagon of taking these hormones, because there's other ways to look good and look better with diet and exercise than to do an easy way out by introducing more hormones in your body. And lastly,
okay,
one more thing. There is, I just want to make sure people understand, there is no perfect system for men. No matter what you do, you're going to have some sort of side effects. Understanding what side effects you're able to live with it is what we have to work together to make sure that we do the right design the right therapy for you. So working with physicians, pharmacists is going to be critical to understanding what drug therapy will be best for you.
Okay. Well, since you mentioned that, that in that case, do you mind just mention a little bit about this reversal, like, with the chorionic gonadotropin hormone? I think we haven't mentioned that.
Well, yeah, I think I mentioned about the HCG earlier, the FSH.
Oh, did? Okay.
I did. But again, the drug therapy is a lot more intense than just giving you medication. It's understanding the physiology and making sure that we have a good chance of reviving back to normal without getting any side effects. Because the key is we want these young kids to be off the hormones, not abuse any more things like that, and get them to a point where they feel good about themselves and still be able to maintain the vigor and their body. So that's the whole point.
Well, I really hope that this will help people to understand about the testosterone therapy, especially for men and young people, what to avoid, and hopefully this will help them. So this is Dr. Maria Sulindro from Pasadena, California, with me here. I thank you, Dr. Nayan Patel. He's the president of the Central Drugs Compounding Pharmacy in La Habra. So please subscribe this channel and don't forget to go and put the like and click the bell notification. I will go live every Thursday at 5 o'clock with a different topic, of course. And the interaction or live questions like today is really appreciated. Thank you so much. And see you next Thursday. I do have an Indonesian live program every Friday though at 6 p.m. or in Indonesia is Saturday at 8 o'clock in the morning. Thank you so much, Dr. Patel. Thank you.
Thank you.